Good evening. We are now at week 5 in Social Work 505, and week 5 is around working with difference and interventions with diverse populations. So let's first go to the introduction. The introduction says that this week's unit covers working with differences. We will consider various populations of clients, their needs, and approach work with them in a way that incorporates the differences they bring to the relationship, as well as acknowledges the impact of oppression. This week, we will look at how we communicate our perception of the diversity that our clients bring to the helping relationship and how the difference is incorporated as a strength in the goal planning and intervention process. So as in previous weeks, there is an introductory video that you should take a look at. The learning objectives for this week are as follows: to demonstrate an understanding of ethnically sensitive generalist social work practice with clients from culturally and ethnically diverse populations, and 2, demonstrate understanding of assessment, intervention, and evaluation with community client systems. So now let's take a look at the learning resources for this week. There are a series of readings for this week. 2 of them are from Domain Lum's book on culturally competent practice, Chapter 1 on culturally competent practice, and Chapter 4, a framework for cultural competence. And although this is talking about cultural competence, as I put forth in a video that I attached last week, we have moved towards the term cultural humility. Chapter 11 and Chapter 14 in the John Pullen Strengths-Based Generalist Practice, a Collaborative Approach book, ask us to look at Chapter 11, which is around economically disadvantaged clients and communities, which is authored by Steve Kaufman, and Chapter 14, Generalist Practice with GLBT people. And again, that in terms of identification has expanded, but this is Brent Satterley and Don Johnson. So let's go to our next. So there are 2 discussion posts this week. The initial one asks you to complete the working with difference exercise. And this will require the initial post due Thursday and follow-up response with one of your classmates between Friday and Sunday. This is what that exercise looks like. So it asks you to check from the following list those clients you believe you would experience discomfort in working with, and then it asks you to explain why. So give some precise reasons, and then review the list of clients you check. Specify those types of clients that you believe you would have considerable difficulty in establishing a work relationship, and therefore you should transfer the case to another worker. So let's go back to the next exercise, which I believe asks you to take the video that you did last week and attach that video, and then respond to the video of one of your classmates. And again, the initial post is due Thursday. The follow-up is due between Friday and Sunday. The next is a paper. So this is your initial biopsychosocial assessment paper. And you'll find it in the assignment instructions, but if this comes up quickly, we can take a look at those guidelines. And for whatever reason, it's not coming up quickly, So this is your initial biopsychosocial assessment paper due Sunday of week 5. The rubric and the instructions are as follows. So this is a 5 to 8 page paper, not including the title and reference page. Briefly describe the context of your interaction. Give a description of the client and presenting problem in terms of, in addition to some demographics. Remember to give information about what precipitated your interaction, history of the presenting problem, history of the client's systems, etc. So remember not to provide any information that would allow peers to identify a specific person. Then you're going to transition from your description of the presenting problem to identification of target problems for intervention. So in this, you will incorporate the phases and dynamics of the treatment process, incorporate the phases and dynamics of, again, it's repeating itself, the treatment process, and give your hypothesis of why the problem is occurring. And you can draw on theories to strengthen your discussion. Describe the process and skills of engagement and assessment that set the stage for the intervention. Address possible trauma-related experiences. Make sure to address issues of diversity and comment on your comfort or discomfort level throughout this interview. And as always, provide references for your paper in APA. And the rubric is as follows. This paper, if I remember correctly, is 100 points. So please make sure that you follow the rubric and know what is being required. Follow the requirements above, and if it makes it easier, do a highlight the areas that you're covering, use headings, and that might make it easier for you. So let's talk a little bit about some of the things that were contained in the readings this week. As always, please do the readings completely because they go over many, many things that I won't go over in the PowerPoint. But just to highlight a few things for this week. And this is going to be difficult. So, talking briefly about culture and clients. Social work practice should be culturally relevant to our clients. Cultural factors can influence how the problem gets described, can impact the relationship between the social worker and the client, and can have an influence on how the family is or is not involved. Generalist practice characteristics of diverse practice. There should be an emphasis on professional relationships that are characterized by mutuality, collaboration, and respect for the client system. Also, a focus on practice assessment that examines client strengths and problems in their interactions among individuals and between people and their environment. Should include knowledge, value, and skills to enhance the well-being of people and to help ameliorate the environmental conditions that impact them. Should also have the skills of defining issues, collecting and assessing data, planning and contracting, identifying alternative interventions, selecting and implementing appropriate courses of action, and using evidence-based research, technological advances, and termination. And generalist practice, characteristics of diverse practice approaches and includes skills for practice with clients from different social, cultural, racial, religious, spiritual, and class backgrounds, and we can include many more, including systems of all sizes. One of the chapters talks specifically about poverty and social work. So many of our clients that come to us as social workers are coming because of the impact of poverty. So it impacts many of our clients. It's caused by both structural and systemic issues like discrimination, racism, inadequate educational systems, inadequate wages, lack of quality employment, environmental issues, and lack of access to basic necessities. But poverty can also result from choices that people make. It may be because of lack of their own internal motivation, health-related issues, behavioral health issues, educational choices that people make, and then family issues. Culture in the LGBTQIA community. In the chapter by Brent Satterley, one of the authors, Parker, describes sexual orientation as the direction of an individual's erotic love and interpersonal feelings. They list 6-stage identity development by Cass. Identity confusion involves the recognition of difference in oneself, and that such a difference may be described as GLBTQAI. A second stage is identity comparison, where one compares themselves to the larger dominant heterosexual culture. Can be identity tolerance, reflects relative certainty of LGBTQIA identification. Identity acceptance involves the adoption of one's identity as a positive aspect of oneself. Identity pride reflects recognition of differences between a positive sense of self and the negative stigmatization in the dominant culture. And then identity synthesis involves acknowledgement that some heterosexuals are gay affirmative. If we think about strengths perspective in terms of practice in the LGBTQIA community, there are 3 aspects that Messenger talked about. One is building rapport. First, social workers must be able to reflect upon their own attitudes and biases about this community. Social workers should assess their own presentation of self, including their office space, their assessment tools, and use of language. And members of the community LGBTQIA community who are social workers need to consider their own identity disclosures prior to meeting with clients. The second, after building rapport, is assessment. How knowledgeable are the clients about sexual orientation and gender identity? Where are clients in their own sexual identity development? How comfortable are clients with their own sexual orientation or gender identity? And are there other aspects of their identity that are important to them? And the third is planning. According to Messenger, treatment interventions should consider client self-determination regarding coming out and self-disclosure, and planning should also revolve around listening to the narrative of the individual. So what's our best practice recommendations for social work with this community? And I apologize for the small print. This is generally not the way to do slides, but I decided to try to get this all on one slide. So social workers are to be encouraged to recognize how their attitudes and knowledge may be relevant to assessment and treatment and seek consultation when appropriate. Strive to understand the way in which social stigmatization poses risk to mental health and well-being. Strive to understand how inaccurate or prejudicial views may affect the client's presentation and treatment and the therapeutic process. Strive to be knowledgeable about and respect the importance of all relationships. Strive to understand particular circumstances and challenge faced by this community. Recognize that the families may include people who are not legally or biologically related. Are encouraged to recognize the life issues or challenges that are related to multiple and often conflicting cultural norms, values, and beliefs that members of racial and ethnic minorities in this community face. Consider generational differences and are encouraged to recognize the challenges experienced by members of this community with disabilities. In terms of transgender clients in particular, Israel and Tarver give the following for social work practice. Recognize that transgender identity and gender identity issues are not mental disorders or diseases or are not pathological. Recognize that while stereotypes and discrimination exacerbate circumstantial differences, members of this community are not known to have a higher incidence of mental disorders than the general population. Social workers are encouraged to consider a transgender client's current gender presentation, the individual's placement request, and gender history. Should consult with a gender specialist to plan transgender inclusive and appropriate interventions. Should consult with a gender specialist to provide sensitivity training for staff, and should use the terminology, i.e. gender pronouns, that are requested by the client. And the last two slides are the references that were used to put together this PowerPoint. So you have the overview, you have the readings that have been assigned, you have the assignments for this week, the 2 posts and the paper. I look forward to reading your posts this week, and if there are any questions, please send them to me as quickly as possible. Have a wonderful evening.